SelfCare has emerged as a vital approach to improving reproductive health outcomes. In today's episode of the Empowered Choices podcast, we will explore self-care interventions, including HIV and STI self-testing and menstrual health management. The panel would also discuss the opportunities, challenges, and safeguards necessary to ensure that self-care tools are accessible, safe, and empowering to all. Hi, my name is Benny, and you're welcome today to another podcast session. I have with me in the studio some wonderful guests, and I would like them to introduce themselves. They are looking beautiful, and they are about to share an important message about self-care services that we have now in our culture. I'll start with Adele. Right?
Yes.
So introduce yourself to the people.
Okay, thank you very much, Benny. I am Adele Myra Inkansa. I am a registered general nurse and a public health practitioner as well.
Hi Adele, you're welcome to the studio.
Thank you.
Hi, Benny. My name is Abigail Ogunroyok. I'm a midwife, and I work with DPAG Family Health Clinic, Accra.
Hi Abigail. You're all welcome today to another session here. So I think we should dive into the topic beyond the clinic, right?
Yeah.
We're saying what is available beyond the clinic. So if a layperson hears about self-care, what does it mean? What should it mean to them?
Okay, so talking about self-care, basically when you want to access a health service of any kind, you find yourself going to the hospital or anywhere else that service will be available. But with self-care, looking at the era in which we live now, sometimes you can get so busy, you may not be able to keep up with the waiting time at the hospital. You may just not want to show your face there, basically. Yes, so having a service that you can have in the comfort of your home or even at the nearest pharmacy, which is still safe and is going to provide you with the results that you want.
Thank you. So basically letting the people know that there are services that go beyond the clinic, right? Exactly. So if there's a reason, a particular reason, could be stigma, could be distance, there's a reason you cannot access certain services. There are other services coming up now that you can access from the comfort of your community and your home.
Yes.
Okay. So, Auntie Abby, so I want to know, is self-care a new thing that people are now realizing, or we are now getting into? Is it a new thing, or has it always been there?
Yeah, I think self-care has been there always. Yes, somebody will get a common headache and just walk to.
That's self-care, but because we didn't have a name for it.
Exactly.
Okay.
So it has been there, and now we want it to be a little bit. We raise the level to another level. Raise it to another level. It is because now we have the phones around, and then we have people at the other end who are ready. When you put in your call and then you tell them what you want, they are able to get it to where you are. Now you don't get to the pharmacy to get it, but then you can just receive it in your home. As my dear said, in the comfort of your home, with all the instructions as to how you are going to go about it, so that it will not be like you walk into the pharmacy and then you tell them what you want, they give you. When you go home, you do it anyhow. But now we give it to you in the comfort of your home with all the instructions, how to go about it, and even what to do if there is any condition or anything comes up with whatever that you are using. You will be able to get to somebody to talk to, somebody to help you, somebody to even remind you of what to do at the time.
So it's good that you both mentioned this very important point. There's something I want to note is the fact that like you said, it has been in existence. It's just that sometimes it doesn't come without the counseling or the other mandatory thing. That's why we are scaling it up and addressing it this way. Because I walk into a pharmacy, my head is saying, it could be anything else, but it's my head that started first, so I'm buying para.
Yeah.
Meanwhile, pharmacy to 3 times a day. I won't call. You go home. No instruction, no counseling, whatever.
Yeah.
So, to my other question, starting from your therapy, do you think, or are there limitations or risks associated with self-care, SRHR self-care, or what we are trying to scale up right now when it comes to receiving the services that comes with counseling and then the commodity? Are there some limitations people are going to still face in this era, or they should know about going into self-care?
Yeah, I think because of how we are upscaling, it comes with all that the person might need. So that if you have the instructions, you go by the instructions. If you get to a point where you have found one thing, you can quickly call, and then you are given the right information. And sometimes you just need the information so that you even know what to do. Or some people, they can just walk to the pharmacy, get whatever they want, but then they want the information as to how to go about it. And this is a way of helping them to do it the right way, so that no complication comes with it or other things don't set in at the point. Yeah.
Okay. So Adele, we've said a lot so far. How does self-care empower individuals, especially the youth and then the marginalized group, when it comes to being able to take control of their health or to manage their reproductive health? How does it come into play? How does it empower them? Since you are a public health practitioner, so I want to know, especially when you go on your engagement and you introduce self-care to people and you tell them this and that, how does it help to empower young people, especially women or young girls, when it comes to managing their reproductive health?
Okay, that's a very important question, because on some outreaches that I've been to, there are some things that you touch on. Sometimes I'm even hesitant when trying to touch on these topics, because to me it seems like these are things that we should know, but you realize that surprisingly people do not know it, and it seems like very basic information, and probably it's due to misinformation or where they are located, they just don't really have access to that information. But when you introduce self-care to them, it empowers them in such a way that they are able to realize that this issue goes beyond what I'm thinking about. Let's take a typical example. When it comes to menstruation, we look at menstruation and you are like, oh, it's a biological process. It is normal. It happens to everyone. But it will surprise you to know that there are new things that you can be learning about it each and every day. To be very honest, for me, there are some things that I did not even know about it till just a few years back. Meanwhile, we've been taught in school and so many things. So giving these people the information, of course, it builds their knowledge base, and they are also empowered in the sense that they are able to take better care of themselves. And also, when they come into contact with information that may be false, now with digitalization and everything, the information is everywhere. It's everywhere.
Whether false, it represents positively or negatively.
Exactly.
It's everywhere. It's what you decide that you are taking out of it.
Exactly.
Because TikTok, and I keep saying it on every podcast. You go to TikTok, they'll say, oh, pull one arm, pull one leg, do this and do that. And I keep saying, it might work for you, the person giving the suggestion, but the person that is receiving the information is also going to add. It might not work for them.
Exactly.
Because we all have different systems and the way our bodies respond to things. So, especially TikTok, you see the misinformation, you realize that people have phones now. They can just go online and access basic information, but they will not find the right channels. So now bring us back. Answer, what do you think are some kind of there are key SRHR services that are currently available in Ghana? Because people need to know this. What do you think are some of the key services available in Ghana?
Some of the key services are the STIs, testing, and then treatments, and then we have the HIV/AIDS, and issues with pregnancy, and even after delivery.
Mm-hmm.
Some informations that you need with your SRH, how you go about it, and even family planning. It's also another thing that we can do there.
Okay. So where can they get this information, basically?
They can get this information from our Yenkasa. You call 0800 2010, and then you can get all the information that you want out there. And then we have others who are also on the same handles and other handles as well, and then they are able to get information from there. But please, you have to get to the right place, call the right number, and then get the right information. Because for all that we do is to give information, and then you make a holistic choice. You do an informed choice, so that you know what to do and how to go about it.
Okay. So you heard it here first, or plenty time. You've been hearing it on this show a lot of time. If you are looking for information or services on anything concerning your reproductive or sexual health needs, please reach out to Yenkasa, the Digital Contact Center, Yenkasa Digital Contact Center, on 0800 20 10. It's toll free, so that means that you can always call us, okay, with the important questions. We're always here for you. And then if you feel shy, you don't want to speak, but you want to send a WhatsApp, a text, then please send a message to our WhatsApp line 0245 118 228. Thank you. So coming back to the conversation, most people don't know about pregnancy options, right, that are available. So I'll start to answer a bit, and then we'll make it a bigger picture for everyone to understand. They always think that there's always one option that is there for them, but there are so many options. Because if it's not that option, then they die. But that is how it becomes that option, or it is over for me. They always think that even when they are pregnant, then their life is over, their life is at the full stop, they cannot move forward from that. So I want to know, tell our people, our audiences, what are some of the pregnancy options that are available to young people in Ghana? And then Adele will also hammer on how we can ensure that individuals receive unbiased, comprehensive information about all their options. So I want you to broadenize the pregnancy options that are available to young people. That is not always one choice. There's a lot of ways you can go about everything if you receive the right information.
Exactly. So that is why when the person is able to get to maybe the Yankasa handles or walk to the clinic, the person is given all the information that he needs with pregnancy, right? I mean, there are so many options. You can deliver, give it out. Somebody wants it, you give it out. Even sometimes we have people in our families who don't have children, and therefore you can just put a smile on that person's face by delivering and then giving it out for the person to take care of the baby. And also, if we don't opt for any of this, and there is anything concerning termination, we are able to also help with that. But we are saying that you have options, and the options will be given out, and then you make the right decision, and then you choose whatever you want, and then it is given to you. So it's not all about the two options that we know, the other. No, we have other options. And when we are, you take people through this kind of counseling, they come to realize that, yeah, you need to do this. Or at this stage, no, I can help somebody, or I can do this for myself. And therefore, it's not all about, it's over for me. No, it's not over. You can still do something with yourself. Even in that state, you can do something with yourself and help yourself. If it's STI, yes. Saying that, yeah, you can take the treatment, all right. But we wish that if you are given all the information, depending on where you stand, you can choose that, okay, after the treatment, then I will have to repeat maybe a test to see that I'm fine, I'm free from any infections. And therefore, we had a program recently for young people, and I said people don't even know that there is this pre-marital or pre-pregnancy counseling that we give, but we do.
Sure, yeah.
Yes, we do. We do give that counseling so that the person will know her status with the SRH before.
Genetic modeling and everything.
Yes. With sickling, with blood grouping, and all those things. You get to know it before you even get into any relationship, and then do a step up to get married and all that. Because people walk into marriages and then the aftermath, it's something else. So we have it, we do it for those who want to get into relationships, and then we give them all this information so the person can just walk in and then request for those tests to be done, or you can speak to the Yankasa, and then they can
direct you to
wherever. Yes, and then also I say that we have our friends, our loved ones. Please, if you love somebody, show it by caring about the person's health. That is number one.
That's true. I like that.
That is number one. So in giving out throwing out a big party, it's good, it's nice. We love it. But I will love it more if you give me a cheat. Walk to PPAG clinic, and then they'll do a screening for you.
Isn't just a card that has information that I can access? Yes.
As a birthday gift. Yeah. Just do it for the person.
Miss, you're thinking about me. It's not just my life, but you're thinking of my life to a thing where you want me to have good health.
Exactly. Yeah. Because good health, you can give everything to the person for the person to appreciate. But if you are able to give good health to the person, you will be forever remembered by that person.
That's true.
So in throwing out parties, presenting big bouquets and
now once again give us help.
Yes, and the longest and biggest cakes.
Hey, give us help.
Yes,
we want help. Give me 1 year free consultation with a doctor.
Yes,
like monthly by yearly checkup.
Yes.
Give me card. Yeah. So those what's the name? Gift card that you give with your receipt. If I give me the doctor version, so that I'm going for my checkup, because health is everything, and it's become expensive now.
Exactly.
So even if you give a small bit of it to someone, whether it's just information you are giving, you help the person, you've extended the life.
It helps a lot. So I said for the networks too, I think some of them do that by presenting cakes and things to you. So please, we can turn it around, and then instead of presenting the cake, present the cake.
Corporate day for health. It's a nice idea.
Yes.
Someone bringing health right to your doorstep. I've seen one online where because bank workers are so busy, they sent markets to them. So at the compound, the woman who sells food stuff, she just bought everything. So the lady just came out and shop and everything, and they were so excited. Imagine just doing mobile clinics, sending it right to their doorstep. You'll be working here every day. Your BP is rising. Your heart is beating. Okay, now let's bring one Saturday we come. BP monitoring, checking what is wrong, what self-care do you need, what other ways can you get medications later on. So it's not necessarily every time you have to walk, leave your house and pick a car, Jenny, whilst you are sweating, the people you're coughing in the car. Okay. So, Adele, let's continue. So, how can individuals receive unbiased, comprehensive information about all their options or all the self-care services?
Okay, so first of all, when it comes to SRHR, as soon as you mention SRHR, I don't know about you, but for me, some of my friends, when they learn about the field in which I'm working, they think that, your work is all about sex and this and that, but
It's
we
more
have
than
to.
that.
It's more than that.
Yeah.
It's deeper than that. Yes, and looking at something like pregnancy, you should understand that it is not a curse. It is a blessing. It is the consequence of an action, basically. So whenever we find people pregnant, especially teenagers, or maybe when it's not at the right time, you find that they are even afraid to try and access services because of what people will say, and it's a big limitation. And let's take that to the other services around as well, STI testing and all of that. Okay, the person might not have done the right thing, and it may have ended them up in a particular situation. But right now, your job as a healthcare provider is to provide the person with all the options available to them and help them to make an informed decision, because you are basically there for the person. And so in order to have access to unbiased health care, I think a lot lies on we as health professionals. A lot really lies on us, because mostly when you speak to young people, at least for the young people that I have been able to speak to, you realize that, well, I don't want to go there because I'm going to meet someone who is, practically old, and they are just going to judge me about my choices. They are going to judge me. Why are you coming in for a contraceptive method and all of that? And sometimes they are not lying, because I believe we've all seen that sometimes it happens, which is quite unfortunate. Yes, but this is a time where I think more training has to be done. More training has to be done when it comes to health professionals, because we are mostly the first points of contact. If they are not able to come to us, that is when they feel like, okay, then my next option is to listen to that random TikToker online. And for example, one TikTok video I saw, they just hold up some 2 drugs meant for termination of pregnancy. Then they'll say with a caption that if you know what these drugs are used for, you are going to hell. Then I'll go to the comment section and you see that, people actually know what it's used for. People have been using it, they've been abusing it. And so someone will go there, see this kind of information, and will not even bother to, cross-check and see, is this really true? As long as it worked for someone, then it should work for me. And then they go in and they use it, and they end up with so many complications and problems. So when we are talking about self-care, yes, we are bringing the care basically to our doorsteps, but how are we going to regulate it in a way that is going to be safe for us, in a way that it doesn't carry misinformation, in a way that is actually going to achieve the purpose for which we brought it about? So these are very critical issues when you are looking at the issue of self-care, and if we really address them well, young people and everyone in general is going to be able to receive unbiased care when it comes to SRHR in general.
Equitable, affordable service.
Exactly.
So that you don't have to be in the long queue at the hospital.
Yes.
So to wrap up, Antabi, what do you think health providers, or what role do they play when it comes to ensuring that the safety and reliability of self-care practices? What role do healthcare providers play in general?
As I said earlier on, when you are giving out self-care, you are helping the person to know that I am here for you, and I'm going to support you in every step of the way to get to where you want to be. And therefore, anytime that we are giving out maybe a package for a person to use, we make sure that we add our phone numbers, we add numbers that they can reach at every point in time, so that they will not be found wanting. At the point that the person feels that, I've been left alone to do it myself, whatever happens there, it's me. But then it brings a sort of a breach in what we want to achieve, and therefore we have to always be there for them, so that if at every point or any time the person calls, sometimes it's a bit uncomfortable, but you have to do it to help the person to achieve what he wants to. And also, if we are giving out anything for self-care, we make sure that the person has there is a clinic or a health something around that if there is anything, the person can quickly get to the point. And when he gets there, we give them our numbers so that even if the person there doesn't want to help, you call and I can talk to the person, give instructions as to what the person will need, and therefore the person can achieve what he wants to achieve.
So how can, Adele, the last question, how can digital health tools support the safe and informed use of self-care methods when it comes to both STI, it goes to HIV, pregnancy options, menstrual hygiene and all that? Because many people buying pad, it's self-care. So how can digital help too? Because even with pad, you know that online, you go and see different versions. Like this one there to take away the pain, this one there to come on. Like it's a lot. So how can we make digital health tools safe and very informed for young people?
Okay, thank you very much. So in this era where everyone is just doing their own thing, and as I have been saying, there's so much information going around when it comes to digital health tools. For example, you've been mentioning your toll-free line. Exactly. I'm sure there are various applications that provide all the information that we need. These are very important tools, and we need to really push them forward, because we are the ones providing the right information. And so if innovations remain at, let me say, a low level, how is it going to get to other people, especially even in the rural areas where they might need the information more? Yes. So when it comes to digital health tools, it lies upon us to make sure that we provide all the accurate information to combat the wrong or negative information that has been put out there, basically. So that's one way. And also, this podcast session basically is another tool, because I can imagine the number of people it's going to reach, and these are people who may not even know much about what we are talking about. Yes, so we have to push the agenda of having more of these things. We may not always be able to, have outreaches and everything. Even when you have the outreaches, you visit the place once. That's the end.
It doesn't change. It's behavior is an overtime something. Exactly. Or we go one, then maybe 4 or 5 minutes, and you go again. It doesn't change behavior.
Yes. So maybe you say that, we are going here to provide free sanitary pads to the people. Okay, when you leave the place, what's next? What are they going to use in the months to come? Do they sit down and wait for another group to come and give it to them? So we have to look at all these things, sustainability issues, and empowering the people themselves to be able to take charge of their own care at a certain point in time. Yes.
Thank you. It's been a wonderful discussion. So your final statement. So you look into the camera for me and give your final statement. We've talked about self-care. We've talked about different components, pregnancy option, STI, HIV, menstrual health management. We talk about how to make digital health tools very safe for young people. And we will mention some of the tools and services that are available for young people, so that they know that it's not every day you pick a car and say, I'm going to hospital. In fact, the doctor to patient ratio is very high now. Sometimes you go, even anytime you come back, you've not still been attended to. True. But there are other ways for you to get the help that you need, especially when it comes to your reproductive and sexual health. So your final statement to our audience is, what is it like, or what do you want to tell them about centralizing reproductive health as a component of health in general, but self-care as a component of reproductive health? What do you want them to know about self-care?
Okay, so first of all, I'll just like to say that SRHR in general, let's not continue viewing it as, let me say, a taboo topic. It's like a very silenced topic in society. It is a part of our health. It is natural. And so don't feel shy when you are trying to get information or access to a particular service, because in that case you are doing yourself a great disservice basically. And so all I'll say is that with self-care, you are empowering yourself, you are giving yourself that autonomy, okay? And so be open to receiving the right information from the right channels. Be open to following instructions. Be open to, when it comes to follow-up care, open up yourself that this relates to my health. Is very important, and so I really need to take charge of it and view it as an important part, so that together we can all reach the goal that we want to get to when it comes to SRHR in Ghana and beyond.
Thank you. Auntie Abi?
I think self-care has come to stay.
Yeah.
And we have to give it all the push that we need to give it, so that it becomes part of every household, part of every community, part of every shelter. Even the person who is living alone somewhere on the farm. Because now we know that almost everybody or a lot of people have phones. So we are about 14 million or so. Or,
Yeah.
Yes.
But the phones that we have, it's more than 14 million. Because somebody might have 2, 3, or 4.
Yes.
And therefore, we can get all these. If we can get all these informations on our phones, why don't we just access it? It is there for us to use it, and it has come to stay.
Yeah.
It has come to stay. So let's give it a step.
Thank you. And I also thank you to our audiences first, but then to you, my wonderful guest, for joining me for another episode. So if you're at home or you're online, wherever you are listening to us from, make sure to follow us on our digital platforms, Yenkasa_GH on Instagram, Twitter, and then on YouTube, PPAG Ghana, for all the information that you need about your sexual and reproductive health. And also, don't forget, Yenkasa is here. Call Yenkasa on 0800 20 20 10 and on WhatsApp 0245 118 228. Until next time, bye.